So the question comes up, how do you decide who you're going to train, and how does somebody get certified in this work? Well, we're really picky. We've had hundreds and hundreds of people ask to train with us. We've accepted, a dozen? To train with us, we need to first see their continuing education, see where they've studied, if they have the basic educational background and manual educational background using their hands to even learn what we want to teach. And then we have them come in, we look at their personalities, we kind of judge their personalities, and then I have them work on me so that I can say, yeah, this person can pick it up. This person is intuitive as well as very, very bright. Or if this person's a mechanic, they don't get even invited. So the certification, once we determine that somebody is appropriate for certification, we'll have them study a 550-page book that my wife wrote. It has over 220 illustrations, all color, of different parts of the body. How we treat in those different parts of the body, over 220 techniques, frankly. And so when they come in, so they'll study that for at least a month. They'll generally studying it for 4 to 8 weeks. Then they'll come in, and they'll fly to our home office in Gainesville. This is how we're doing it right now and have been from the beginning. And we immediately give them 2 tests. One, we give them a multiple choice test to see what is your practical knowledge, because a lot of the book is about fertility, the other conditions that we treat, abdominal conditions, pain in general, adhesions. So we test them on that when they first come in. We also give them a list of all these techniques, and they mark each one 0 to 5. Like, I really know this one. I don't even know what you're talking about in this one. So that over the next 2 weeks, we go through all 200 odd of those techniques, sometimes acting as therapist, sometimes acting as patient, going back and forth so that we can fill in. We'll check them out on all of them, but we want to really fill in and hone in on the ones that they don't know. At the same time, transmitting our knowledge about the different conditions, how and why we treat in a certain area, how we get the results that we get, frankly. At the end, they're given another test, another multiple choice test. It's about 150 questions. And we've also gone through all the practical with them. If they pass all of that, then they are certified, and they get our certification. We give them a certificate. Our therapists, as I'm speaking now, average about 26 years of experience each, so most of them are not young guns or young gals. There are a few that have 5 or 6 years experience, but they were just so good that we had to accept them. But they are in the great minority, and they're excellent. If they weren't excellent, they wouldn't be our therapists. So if you go to a therapist and that therapist says, oh yeah, I know what they do, they don't know what we do. If they have not been trained by us, they don't know what we do. It is very easy to say, and really to think, oh, I can do that. No, I know how to treat in the abdomen, or I know how to treat in the pelvis, but to actually go through a certification where you study specific conditions, specific treatments for specific conditions. You palpate body after body after body. You work hands-on with the people that developed this work and have published all the studies and have had their studies published in all over the world. It's quite different than someone who says, yeah, I know what they're doing.